with a red patch, all right, or like a mosquito bite. So the moment you have a red patch, it's a little bit itchy, yeah? It's not normal to the other areas. I would always advocate quickly start whichever range of products, whether it's Biolane or it's any other company, quickly start applying them. It is, a lot of us these days are going towards natural, organic, all right, chemical free, all right. So it is, it's very helpful. See, there are many different kinds of oils, essential oils that I use. Lavender oil, grapeseed oil, argan oil, almond oil, these things. So these are all more natural, rather than you've got a mixture of chemicals in it. So we are heading in that direction. Due to industrialization, we have to use more natural ingredients, and yes, it works on our skin as well. It's equally good. Yes, I do. Moisturizer, no. But if I need to advocate, I need to administer, steroid creams, okay? It all depends on the age. For babies, you would use 0.5% hydrocortisone, all right? To a little bigger, 1% hydrocortisone. It depends on the severity. Once they're kids, probably around 10 or 12, you can give them more Methasone, all right? Adults, you would give a bit more stronger range, the better Methasone, all right? So that, yes. Treatment based on age. The first thing that they do is they switch, all right, between product to a product to another, all right, without knowing what the underlying problem is, you know. So always see a doctor, get to know what the underlying problem is first, and try to get the advice of the doctor. Because just switching from one product to another may not help the child. Sometimes it can make it worse. So number one, switching of products. Number two, they tend to use like traditional stuff, oil, and you know, a lot of times it makes it worse, you know. And then of course Google doctor, off counter, OTC. So yeah, try to avoid these. Always see a doctor, get the diagnosis, what is the problem and what can be done. It does. Some people tend to have allergy towards certain group of food. Common allergies are like seafood, even chicken, brinjal, these things. A lot of people have these allergies as well. So what I advise them is that if you actually have an allergy to a particular food item, the best advice is withdrawal. Because if you persistently consume that particular food item, it's going to relapse and relapse and relapse. You're not going to get better. So I tell them to, avoidance is the best advice. Yes, like I mentioned earlier, usually you give a period of up to 5 years, and after that, it tends to, you know, the graph, you know, it goes up, it plateaus, and then it comes down. So yes, it does settle with advancement in age. At the top of my list is Biolane, all right? Why Biolane? Because Biolane is for hypoallergenic skin, all right? It's been dermatologist tested. It's been about 40 over years in the market. And when we use a product, it's important to look at the key ingredients. What is the active ingredient that is making your skin better? And I noticed in Biolane, they've got these few key ingredients, which is their signature ingredient, which is the Hydroblane. All right, it's an active ingredient to help with atopy and dry eczema skin. Okay, then they've got germ oil, they've got lipid content. So these are the things that you look for. Besides that, there are a lot of other range out in the market as well in the pharmacies. As long as there's high glycerin content, ceramide, hyaluronic acid, these are all ingredients for high moisture content. So you look for these key things, you won't go wrong. They've got 4 products actually, all right. Once the baby is out, okay, right up till, you know, they are, you know, kids, all right, you can use this range, all right. They've got 4 products. One is the moisturizer, one is the hair and body wash, one is the micellar water, and the last one is a nappy rash cream. So the moisturizer is used after you've had your bath. You apply it all over, especially in the affected areas more often. The wash per se is soap free, it's paraben free, so it's chemical free, so it's hypoallergenic, which is gentle to the skin. Alright, the micellar water is a solution that is used to cleanse and to wipe. So you can use that to cleanse the baby. See, after eating you've got all these particles, so you can just use this micellar water. Even the baby's bottoms, you can just use micellar water. Why? Because when it is applied, it creates a thin biofilm on the skin, so you don't rinse it. So it's like a protective layer, alright? And they've got the nappy rash as well, which is quite common in babies, because of the heat, the sweating, and the close environment of being in a diaper, alright? It sort of traps in the air, yeah, so you get all these rash and allergies with the piss, yeah.